So tell me, and maybe we can just end with this, which is pie in the sky. What would you like for people with protective body disorders? What kind of treatment, what kind of help, what kind of attention, awareness would be the perfect combination of what you think would help anyone, whether it be somebody who wants a cure or somebody who wants to just be okay with the way their body is?
Great question. And I will start by saying one piece that's very important. So people understand that this answer that I'm about to give is really a response. So in our private Vaginismus Sisters community on Facebook, I do regular Q&R sessions. And the reason they're not called Q&A sessions is because that I recognize that nobody has one answer that actually fits every single body. So anytime that I give my guidance, my support, my advice, as I would call myself a guide, but maybe you could consider that I'm a coach, this is a response that's based on my personal experience. And what's really important is that we empower people to trust their own intuition, create a communication with their body where they can really understand what fits and what doesn't feel right. So they can listen to any response just as that as a response. It is not my answer. And they can sift through all this information and they can say, this feels good to me. Therefore, I trust myself to take this path of action. Mm-hmm. So that's why a Q&R session.
I like that. That's really good. I think more people would be open to participating if they heard it as a response as opposed to an answer.
Yeah, I feel the same. And I've seen that positive feedback from our community as well. And hence my response to that is, number one, trust yourself and trust your intuition. But here are some of the people that would be really great supporters, right? You might want to speak to a pelvic floor physical therapist. This is a very, very relevant medical professional, specifically to be able to also physically see and tell you about the state of your pelvic floor muscles. Sometimes a diagnosis of vaginismus is going to tell us that our pelvic floor muscles are overactive, and that's true for most people. But there are certain cases in which relaxing the muscles needs to actually come also with strengthening the muscles at the same time. We hear about standard Kegel exercises. For most people, they're not appropriate for overcoming vaginismus, but reverse Kegel exercises are the way to go until we find that control of our own pelvic floor to be able to slightly contract and deeply relax, and then to strengthen that if needed at the tail end of the journey with standard Kegel exercises. So pelvic floor physical therapist can tell you all about that specific to your body. Of course, dilating and trigger point release and vaginal dearmoring are also things you can do at home, but having a pelvic floor physical therapist support is fantastic. A sex therapist, right? Someone who can look into the relational dynamics, the erotic pieces. This is pillar number 2 and how I approach coaching women through overcoming vaginismus. It's finding and embracing your authentic sexual self. So often there is a rejection of our authenticity as erotic beings. And because we reject that, our body also doesn't feel safe to truly be itself, to be able to relax, to trust you. And so often vaginismus is also the thing that says no for us. So with understanding our little t or big T trauma, our relational dynamics, our experiences of eroticism in the past, and maybe the shame we hold for that, we can start to recognize that our body has needed to protect us and say no for us because we haven't verbally done that ourselves. And it's only when we take back the responsibility and show the body that it can trust us, because now we hold its no and we will express it whenever it's necessary. Only then the body can actually feel safe enough to surrender, rather than feel that the only path to safety is by always being in control and tightening and protecting itself. So that's number 2. Speech pathologists, especially if swallowing challenges are present. Obviously, number 3. And there are so many other holistic practitioners that can also support you. This is part of the practices that I do with people, all sorts of things, including tension and trauma release from the body, subconscious kind of healing and emotional healing practices there. There's just, I love being able to look at this as a tribe. And each person out there deserves a tribe to support them, right? We're not meant to do this on our own.
How many people are involved in Vaginismus Sisters?
Our community has grown to about 5,500 on the initial page that I started. That used to be called Pain Free and Intimate. And it's transitioned over to a new page called Vaginismus Sisters. So that community is still small and growing, where the original page I've renamed to my name simply because I want to share about a wide breadth of topics on sex, love, relationships, and even business to support other people who are wanting to share their gifts in the world. So now we've got Vaginismus Sisters and Katrin with Love.
Oh, I love it. I love it. I would encourage as many speech pathologists as possible to consider following these groups and following you on Instagram, because they may learn about the kinds of patients they may interact with, but many, given that our field is so female, many people might actually be dealing with these protective responses that are in their mind. They should understand it because I understand the body. Why can't I make my body do X, Y, and Z? They might be more open to a path of accepting what your body does, even though you can explain it to yourself, right? It reminds me of my son, just a quick story. When he was really young, he came down and for some reason his eye was draining, just draining. And he goes, why is my eye draining? And, once we figured out there's no irritation, blah, 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 I was explaining the lacrimal glands and how, there's a part of your brain associated with that. He goes, so what you're saying is there's a part of my brain that wants to know what's happening and the part that's doing it is right next to it and it won't tell it. I'm like, yeah. That's about the smartest thing I've ever heard in my life. But yeah, absolutely. Your brain, it's like you versus you in a lot of these things, be it pill swallowing or vaginismus or really anything. It could be motivation to start that business. A lot of times it's you versus you, right? It doesn't mean that you don't know yourself. It means the body is confusing. And the coping strategies, as you said about trauma, that we put into place at times when we didn't even know what we're doing are so ingrained that it's difficult to understand how trauma lives in our body in a physiologic manifestation. For some people, it might be anxiety and social avoidance. And for somebody else, it might be protective responses. People have all kinds of physical responses, like a lot of people blink a lot, or just all kinds of things that people are doing and they don't know when it started. It's just always been there. And to your point, it could just be that a community of people who are just sort of variations of normal and functional is where you want to find, like, where are you on the spectrum of functional behavior that makes sense for your body that might not be the pristine, normal, anatomical Grey's Anatomy book version of humans.
Yeah. And comparing to ourselves is really the only comparison we should be making, like you said. So often we compare to others, and comparison to others is the thief of all joy. So
Yeah.
Quote that I really like. So the only person we're trying to grow from is really the old version of ourselves. Not that that person was not perfect. They were, but it's important for us to see that and to just create a life by design in the way that we feel safe in the world and can therefore allow our body to function from that place of safety. So to close off this amazing conversation, let's really get an example of the kind of impact that these challenges have in our lives from the perspective of swallowing. Can you tell us that touching story that you shared with me last time?
Yeah. I remember, as I said before, I've seen a lot of patients who have had an onset of dysphagia that they never lived with. And they would tell stories to me about things that they dreamed that they'd be doing with their life that they never thought swallowing would keep them from doing. One of the most touching stories is a man who was maybe in his 50s or something like that, and his daughter was getting married. And the way that he talked and broke down about having this dream. Now, this is somebody with dysphagia, like serious dysphagia, where he has difficulty swallowing thin liquids. And what people don't realize is that that's one of the hardest types of food to swallow, because as you can imagine, liquid moves quickly and your swallow response has to be fast and precise enough to keep up with it. And as we age, our swallow slows down just like everything else. Like our bodies slow down generally, our vision is more blurry and our hearing is less acute. Same thing with swallowing, right? And so in addition to just aging, he had a stroke or something like that. I'm not exactly sure what it was, but it meant that he couldn't swallow thin liquids. And so he was really sad about not being able to tell the speech about his daughter, to give her away, and to toast her, clink glasses, and drink at the same time that she was drinking. And, again, you just think you're going to do these things. No one goes at, when your daughter's born at 30 something, God, when she's 20 something, I'm not going to be able to swallow. So you better get married early so I can clink glasses with you. But that ended up being the thing that just really disrupted the outcome that he thought would be the most loving thing he can do. And it just was a reminder that when we talk about our bodies are hardwired, they're designed to do this, how sometimes when we feel like our bodies betray us, it's so difficult to forgive ourselves or to accept ourselves. And this was just one of those touching examples of that.
I got goosebumps all over again as you spoke about that, because this is what we're talking about when we consider quality of life. Mm-hmm. And it's our body betraying us that the feeling is, right? In the context of experiencing vaginismus, it really isn't about us becoming a receptive partner to penetrative sex, right? As women, we're receiving another human inside of us. By the way, this is the most vulnerable thing ever on the planet, to open yourself to another human, right? The form of surrender that we require to be able to do that is huge. But what's true is that it's not about that. It's about us feeling like we can participate in our conversations with our girlfriends about sex and pleasure. It's about being able to even conceive in the way that we want to conceive. At one point in my journey, I was at a place of trying to convince myself to accept my reality, that I'm just going to be this hotshot businesswoman and I'm not going to have a family and I'm probably not going to find a partner, and that's just my reality. So it is also about those things that relate to our quality of life.
As I listen to you saying that, I think about the consequences of this man toasting and you making decisions about you saying something like, well, I'm just not going to find a partner. And I know a lot of people are probably going, well, what would happen if he just drank it? In his case, his explosive coughing would be the antithesis to the memory that he would have of taking this sip. Like, it wasn't like it'll go the wrong way. He'll get pneumonia tomorrow, but he'll deal with it, not tomorrow, in a few days. But it was really just like an explosive response. It was a very big social moment. And that's all anyone would remember. It would literally dampen the enthusiasm. And I think about you talking about that and partnership and this idea that men experience sexual intimacy with women by thinking about entering them, right? And there are all kinds of other acts that can be intimate, but that's what a lot of us have been trained to do. That, when people are making love on TV and it's not Halloween, Lord Jesus, it's Valentine's, although, hey, Halloween turns you on, you do you, right? But it's always those like hyper romantic soulmate situation. It's usually penetrative sex. It's not like, oral sex or something like that, or using toys. Not that that can't be the thing, but we've been conditioned to believe that the whole social programming around this would go away. And you would probably meet somebody who's really okay with all the range, the big full spectrum of what it means to be intimate and sexual with somebody, to be okay with it. And you'd have to have your unique friends you can talk to about it, not just drop into any girl group and be like, girl, let me tell you about the time I had last night, right? It would be like, just like the people with swallowing disorders, they go into these social settings. Everyone's like, why aren't you eating, Bill? Come on, have a beer. Like, oh, I'm not thirsty. And he's dying for a beer. Well, you don't have a beer with us anymore, because what is all your social bonding surrounding? Food and drink. And so they find themselves lying about it or saying things because they don't get invited back, because the people who invite them feel badly that they're eating in front of them.
Yeah.
And so if you're somebody who talks about sex in a painful way, this fun girl gab is probably going to be like, well, don't mention that. It's almost like talking about becoming pregnant and knowing somebody else can't get pregnant. You save that for the people who you think you won't hurt by talking about your life experience.
Yes. And then you become an outsider in that group, because people are trying to do their best, but everyone's kind of walking on eggshells, and it just becomes a really uncomfortable situation.
Mm-hmm.
And in romantic relationship, like you said, food is the thing around which we bond. Well, intimacy is how we bond in our romantic relationships, whatever that means to us.
Yeah.
But unfortunately, our definition is very much based on the PIV sex imagery that we see in the media. And it's really hard to let go of that idea and say, I don't need that. That's just not something I will ever enjoy. And I'm okay here because there's always this other place that you were always aiming for in the first place.
Yeah.
What's the impact of us not having that intimate connection? Well, I remember starting to avoid having any form of sex with my partners in the past, oral sex. Then I started avoiding kissing. Then I started avoiding touching because I was dreading where this might be leading, because the next base was just a reminder of how I'm not good enough and how I'm going to experience the physical pain, but then I'm going to experience the disappointment with the layer of disappointment that I couldn't satisfy my partner, who I love very much and I want to satisfy.
Yeah.
So it's about the quality of life here. It's about the function of our body, yes, but it's about the quality of life mostly. And hence, the invitation is that we consider this at any point that we're interacting with someone that's asking for our help. How is it that we can invite them to have that tribe of support? And perhaps we can talk about some practical ideas here. We can kind of popcorn out what we believe are practical tips and things that could help. And perhaps we can invite people to also comment under this video what they would like to see in our community. So together as a society, we can actually put them in practice.
You know what I think would make healthcare providers look inside themselves is if we armed patients or potential patients, meaning like I'm interviewing you too. I think healthcare providers, their schedules are so slam-packed or jam-packed that they think that, you know, if somebody doesn't come see me, look, it's okay, I'm booked today. So they are the one that's in demand, right? But the idea that maybe some patients chose not to see them is something they're not used to experiencing. I have been in circumstances where I felt like I was not being heard, especially when it came to, child and maternal health, where Black women die more and their kids die more, regardless of how healthy and our socioeconomic status, because we're not being listened to. And I've had to say, and I have practice with this, right? I have to say, I have concerns about the profession and that the culture here is to do this, except for Black women. Studies show XYZ. Can you tell me how much you've thought of that? And I'm watching to see how much they tap dance. Yeah. Their inability to answer me is an indication of their ability to care for me. And so if I come with questions about how my body's going to be treated and you can't answer that, and that's literally what you're being paid to do, I'm gone. Because it's almost better for me to wait and get a better healthcare provider than to just, well, I'm already here and feel the pressure of you saying, no, we're cool with that. We never have that problem. No one never has any problem. That's already an indication there's a problem. So if we armed patients with questions to ask their providers, like, how conservative or liberal are you in terms of giving patients an opportunity to try to swallow, even though you see that there may be some negative consequences? Are you the kind of person who will recommend a PEG tube at the first sight of any residue left in the throat? Tell me more about your track record. Then they're like, oh, this is an educated consumer. I just thought my word was bond. Like I thought I was the gold standard here, right? If I said there's a problem, that was going to be it. They're asking me questions. It's almost like Uber drivers versus taxi drivers. If everyone's getting a star here, then the Uber drivers are far more careful with me than I find the taxi drivers were, because it was just a one-sided relationship, and they get to stop for you if they want. They drive however they want. There's no way to rate them. So I think that that's one important thing, which is know how to vet your healthcare provider. They're not used to being vetted. And this will get them in the mindset of, wow, my health grades are really going to be impacted if I'm seen as somebody who is not thinking about somebody's quality of life when they come to see me. Like, you're just another number in my chair.
Mm-hmm. I love that. It's advocating for ourselves, putting the power back into the consumer of medical health, providers. And that's huge. I think that also helps with the empowerment piece, right? Is to feel like you are deserving of having a high quality of care.
Yeah.
And some of the self-work is required there from the consumer perspective to feel deserving of that in the first place, to also be able to express themselves with confidence and set boundaries. That's the kind of self-growth that will probably be required for patients before they even come into the office of the medical provider. And hence, that's also a support that we could provide on that side of the spectrum.
Absolutely.
Something else is to help all of us feel less shame related to sex and pleasure. Because what if to become a medical professional, you had to go through training related to pleasure, eroticism, and all of these taboo topics? That would be huge. And I think that would kind of even out and create more comfort on both sides.
I think people don't realize how much shame they have around sex and sexuality, because for every person who was supporting me during the time that the American Speech Language Hearing Association was convicting me for talking about sex, there was somebody who was like, I mean, what do you expect? You talked about sex. Maybe you shouldn't have done that. Maybe you should have kept it to yourself. This is what happens when you talk about sex. So they're not saying it should have happened to you, but they're also like, I mean, this is the world we live in. It's
Right.
still it's still consenting that kind of censorship, right? Again, if you choose to censor yourself because you have your personal issues, that's okay for you to make that decision about your body and yourself. But if two consenting adults want to talk about pleasure and sexual experiences, and you force yourself in that space to shut down their opportunity to talk, then now you're censoring them because of issues you have in yourself. And the thing to remember that I try to take with me wherever I go is that judgment in other people is often an indication of insecurity or shame in yourself. And so we should be really looking at the moment we want to judge and saying, what is it about me that doesn't like this? I mean, are they really hurting somebody? You're like, yeah, you're actually hurting people. Or it does make me feel good, right? So that's why this conversation has been so amazing.
I like to say, if you're pointing a finger at someone, look at the other three pointing in your direction.
Right.
And from a spiritual perspective, everyone we interact with are mirrors to ourselves, and hence we can learn something about ourselves when we look at others. I wanted to say one final tip, just as a vision.
Sure.
What if we could have, from a practical perspective, little like business cards or posters? I've recently created posters about our community for Vaginismus Sisters that I would love every single clinic that might come across someone with sexual challenges to have and to keep top of mind of, ooh, I can hand this to my patient at the end of our chat so she doesn't feel like she's going home alone to the isolation that she was experiencing before, that she actually feels like she has all hands on deck.
Yeah. That's a practical tool that will cut down the work on the part of the healthcare provider who doesn't have time to sit and talk through the things that you talk through, because that's your area. But give them a reference point where they can leave the healthcare provider and say, I still have questions. I still have things that I want to work through. Who is somebody who has experiences like me who can be another reference point? That's perfect. That's a great idea.
Thank you. Well, thank you so much, Ianessa, for having this conversation with me, for being open to these topics and really being a leader and making those connections between both fields of expertise and really standing in your bravery in that way. That's so needed in the world.
Thank you. And I feel the same way about you, because you're standing in your bravery and beyond me, you know what I mean? Like in a way that I didn't know when I was doing these things that I needed to be brave. Do you know what I'm saying? I found out that bravery was required after, but you knew that putting yourself out there like this could be beneficial to you, but it could be almost as harmful as beneficial or worse, depending on how people turned it back around on you. So I'm hoping that you found a lot of solace and community and help and support by doing what you're doing more than any other contrary option.
Thank you so much. I appreciate that. And let's continue the conversation. So inviting everyone to comment and ask questions and get involved in our communities.
Yeah, if you have any questions or just thoughts of other things that we might talk about, if you want us to do another conversation that goes more in depth about a particular issue, please add that to the comments and let us know that that's what you'd like to hear, and we'd be happy to oblige.
Perfect.